Hello and welcome to the Smiling Signs Auslan resource. The topic of this video is interdental cleaning. Click on the timestamp in the description below to be taken to the relevant topic you would like to learn more about. Don't forget to like this video and subscribe to learn more about oral health. First, what is interdental cleaning? Cleaning in between your teeth is called interdental cleaning. It's an important part of daily oral hygiene for both children and adults. It is just important as brushing your teeth. People with gum disease may need to clean between their teeth more often. The aim of interdental cleaning is to remove the food and plaque that gets trapped between the teeth. Toothbrush bristles cannot reach between these tight spaces. Not cleaning between teeth may lead to gum disease and tooth decay. Data from the Australian Dental Association shows that 80% of Australian adults brush their teeth 2 or more times a day. Only 25% of adults clean between their teeth daily. This means that 3 out of 4 adults do not clean between their teeth every day. Cleaning between the teeth is often called flossing. This is because flossing has always been the most common method. There are now other options to clean in between your teeth. These include Flossettes, interdental brushes, and Waterflossers. Talk to your dentist about the best tools for you to use. You may need to use more than one option. There are different types of floss. It's available in different flavors and thicknesses. Dental floss is usually made from nylon or Teflon. Environmentally friendly options are becoming available. Some flosses are covered in wax. The wax coat can help it to slide easily around teeth. Waxed floss may also break or shred less. It's important to floss correctly so that the food and plaque from between your teeth is cleared away. Your dentist can provide a hands-on demonstration on how to floss, but here are some basic tips you can follow. First, take approximately 30 to 45 centimeters of floss. Wind it around your middle finger on each hand until you are holding 2 centimeters of floss tightly. Use your thumbs and index fingers to better control the floss. Next, gently push the floss between the teeth. Third, use a gentle up and down motion to rub the floss along the side of each tooth. The floss can go slightly under the gum to remove the plaque from this area. Remove the floss and clean the next space along using a new section of floss. Finally, floss all gaps between your teeth. Loop the floss around the back teeth and clean those areas too. Throw the piece of floss away once you are finished. Flossettes are another option to clean between teeth. They are also called floss picks. They have a handle with a curve at one end that holds a piece of dental floss. They are helpful for adults flossing children's teeth, children learning to floss their own teeth, and people who have trouble reaching into their mouth or holding thin floss string. Another way to clean between teeth is to use interdental brushes. These tools look like a tiny bottle brush attached to a short handle. Different sizes are available to fit different sized gaps between teeth. Talk to your dentist about the right size for you. Some people may need to use more than one size. Interdental brushes can be used multiple times before being thrown in the bin. Clean the bristles with water after each use. Throw your brush in the bin when the bristles get damaged or if the wire is bent and twisted. Interdental brushes are helpful for cleaning teeth with braces, larger spaces between teeth, and for people who don't like flossing. Your dentist can provide hands-on advice on how to use an interdental brush, but here are some basic tips you can follow. First, remove the plastic cap from the brush. Next, gently push the brush into the triangular-shaped space between the teeth. Third, gently move the brush in and out of the space using a twisting action. Fourth, remove the brush and move to the next space. When you have finished, rinse the bristles and put the plastic cap back on. A tip to reach in between the back teeth is to curve the wire to get better access. Waterflossers squirt water using pressure to remove food and plaque from between teeth. Consider using a water flosser if you have braces, crowns, bridges, dental implants, or gum disease. You also might want to try one if you have trouble using dental floss. It's best to ask your dentist if using a water flosser will help you to care for your teeth. Toothpicks are not recommended to clean between teeth. Regular and rough use of toothpicks may cause gum damage. Toothpicks can break or splinter and get stuck in the gums. There are many better options to clean in between teeth. Parents should begin flossing their children's teeth once they have at least 2 teeth touching side by side. This is at about 2 years old. Flossettes are useful to reach into your child's mouth to clean between their teeth. It may be helpful to have your child lying down with their head on your lap. This can help you to see and reach into their mouth. You could also try standing behind your child with their head tilted slightly back. As children get older, they can begin cleaning between their own teeth. This is around 7 to 8 years old. It's still important to watch and help them. Gums may bleed when you clean between your teeth. It is more likely to happen if you haven't cleaned between your teeth for a while. When plaque is not cleaned away from around the gums, it can make the gums inflamed. Gums that are inflamed can bleed when brushing and cleaning between teeth. If your gums bleed, do not stop flossing. Continue to floss every day. The bleeding will usually stop after cleaning between teeth regularly for 1 to 2 weeks. If your gums continue to bleed after this time, it's best to see your dentist. They will make sure that there are no other causes for the bleeding. Remember, healthy gums do not bleed. In summary, cleaning between your teeth is a very important part of your daily oral hygiene routine. It's best done at least once every day. Try to do it before brushing. There are many different tools for cleaning between your teeth. Your dentist can provide advice on what's best for you and how to use it. Adults should begin flossing their children's teeth once they have at least 2 teeth touching side by side. Don't stop cleaning if your gums bleed. This should stop after 1 to 2 weeks of regular cleaning. See your dentist if it does not stop. By following all these instructions, you can keep your teeth and gums healthy and keep on smiling.